Hi, everyone. I'm Brad Siff. I'm the founder and president of BioWave. This is our 11th webinar. Welcome. And this webinar is on BioWave pain treatment applications using our silver Back BioWrap. At the end of this webinar, we will have a Q&A session. So there's a little Q&A button toward the bottom middle of your screen. So just submit your questions there, and we will do that live at the end. So happy to answer any questions that you have. So this is an image of our silver Back BioWrap. It's made of a very high quality neoprene, and you can see the two very large silver electrodes in the back. This is a wearable compression electrode garment, and the big advantage of this device is that we can treat up to 5 times the volume of tissue as compared to conventional 2-inch diameter round hydrogel electrodes. So we really can treat almost all the way across the entire lumbar area. So this wearable compression electrode garment has an advanced permanent silver fabric technology that is used for the electrodes. It provides compression simultaneously while allowing the delivery of our high frequency signals into deep tissue. There's no guesswork as to electrode placement location because these electrodes are fixed, they're permanent in this garment. This is a reusable device. It's easily cleaned, and it has a 1-year warranty. So this silver Back BioWrap is compatible with our BioWave Pro device and our BioWave Home device. Unfortunately, it does not work with our BioWave Go, our small BioWave Go device. The Back BioWrap comes in 2 different sizes: a small medium, which fits waist size 28 inches to 36.5 inches, and a large, extra large, which fits waist sizes 37 inches to 50 inches. We also have a back extender so that we can, if it's used with the LXL size BioWrap, can treat waist sizes from 51 inches up to 61 inches. The back extender is basically a separate Velcro attachment that extends the LXL BioWrap by up to 10 inches. Here we're looking at the outside of the BioWrap and the inside of the BioWrap. So on the outside, this is the neoprene material that provides the primary compression. It acts as the primary compression strap. We also have secondary compression straps that you can pull and Velcro down to provide extra compression. There are 4-inch snap cables here on each side that connect to the permanent silver fabric electrodes on the other side. And your BioWave Pro or BioWave Home lead wire cables connect to the 2 blue connectors that are coming off the back of the BioWrap. On the inside of the BioWrap are the 2 very large 5.5-inch by 3-inch bilateral lumbar permanent silver fabric electrodes, and the Velcro closure for the primary compression strap is located at the end here. So this device, because we're treating such a large volume of tissue, can target a large number of the nerves coming off the spine. This Back BioWrap, in fact, targets all nerves bilaterally in the region that it's placed. So if you were placing this Back BioWrap across the typical position across the lower back, it would allow you to target the nerves from L1 down to about L5. And so you're kind of targeting this kind of mid-lower back region. But you can position this Back BioWrap to target other nerves depending upon where the pain is initiating from. So if you have a lower positioning of this BioWrap, basically you could target the nerves coming off of about L4 all the way down to S3 and capture the sciatic nerve as well. So, for someone that has a radiculopathy or pain in the sacral region, if you do a higher positioning of the Back BioWrap, you can treat the lower half of the nerves coming off the thoracic spine. So approximately from T8 to the nerves coming off from T8 down to T12. You can also rotate the BioWrap and treat hip pain. And so you could have literally one electrode over the left hip, and the second electrode will be on the left lumbar area of the back. Or if you rotated it the other way, you could have one electrode over the right hip and one would be on the right lumbar area of the back. So this is actually fairly useful, and you can treat more than just the lower back. You could treat thoracic area, sacral area, and also the hip and the nerves that are innervating into the hip. So in terms of muscles targeted, the Back BioWrap, it can be extremely useful for treating myofascial pain. So again, you can treat the muscles in the lumbar region for myofascial pain. You can treat the muscles in the thoracic region for pain in the thoracic, from myofascial pain in the thoracic area, and you can treat myofascial pain in the hip, as I described earlier. So, for example, we can capture the external oblique if that's where if a patient had myofascial pain in that location. So it's flexible. It's flexible in the regions that you can treat in terms of treating myofascial pain. But we're really, the Back BioWrap really should be considered as a first course therapy for both nociceptive pain as well as neuropathic pain. So as I described, it can be used to treat myofascial pain, such as muscle, ligament, and tendon strains in the lower back. But it also can be used to treat pain that results from discogenic disorders, including a herniated disc, apophyseal joint arthritis. It could be used to treat pain from spinal stenosis, from spondylosis, and even pain that results from scoliosis. So it's really a device combined with our high frequency neurostimulation that allows for treatment for a large number of pain conditions that patients face in the lumbar, thoracic, or sacral areas of the back. So let's talk about directions for use. It's really pretty simple. We need to apply a conductive cream to the skin to lower the impedance of the skin so that we can drive our high frequency signal technology through these much larger area electrodes. So we take a pea-size amount, and you're going to put a pea-size amount on each finger. You're going to rub the cream across the whole lumbar area so that where the silver fabric touches the skin, you've applied the cream. So if you were going to treat a hip, you would put the cream, if it's the left hip, you'd put the cream on the left hip and the lower left lumbar area. So again, wherever those silver fabric electrodes are going to touch the skin, that's where you want to place and rub in the cream thoroughly. The 4-inch snap cables should already be attached to the back of the BioWrap. So before you put this on, you want to take your lead wire cable from your BioWave Pro or your BioWave home device and attach them to the blue connectors at the bottom of those 4-inch snap cables, because it'll be very difficult to reach around afterwards if you don't do this first. So you want to line up the silver fabric electrodes directly over the locations that you have pain, and then you're going to wrap the left side of the BioWrap around, and then wrap the right side around the stomach and Velcro that right side down onto the left side. So very straightforward. You want to make sure it's tight and there's good compression, and so that this is going to stay in place. And we need the compression also so that those silver fabric electrodes are really pressed up against your lower back or whatever region that you are trying to treat. Now we want to add additional compression, so you unhook the two secondary electrode straps, pull them forward, and then you're going to Velcro them down to further tighten the BioWrap across your lower back. So we need to have a tight but comfortable compression across your lower back. It's important that we have tight compression, because not only is the BioWrap providing support for your lower back, we also want the silver fabric electrode compressed against your skin, because that will allow for better conduction of the electrical signals from the silver fabric through your skin into deep tissue. Talk about troubleshooting. Let's say you have a connection error, and this is an example using a BioWave home device, and the connection error shows two pads here, two electrodes with an arrow to the body, meaning the BioWave device does not see the electrodes on the body. So that typically means the skin impedance is too high. So one, you always need to clean your skin before you put conductive cream on the skin. So just take a little bit of soap and water with a washcloth, clean the locations of your skin where the silver fabric electrodes are going to touch. If you've got a lot of hair in that location, this will work much better if you shave the hair out of that location, because hair impedes the ability of the electrical signals to pass from the electrode through the skin into deep tissue. If you already put on the conductive cream and you're still seeing this, you can apply more conductive cream, okay? And then that should correct this condition. Now, an unlikely condition is if you had applied too much conductive cream and the skin impedance is too low, and that might, you might have a connection to the device like a BioWave home device, but it might not let you go up higher than 10%, plus or minus, on the device. So if that happens, it may be that there's too much conductive cream on the back, on the skin. So take your BioWrap off, take a towel, rub off any excess cream off the back of your lower back, and rub any excess cream that's sitting on the silver fabric electrodes, and then reapply your BioWrap and start up the treatment. And then you won't be limited to only going up to about 10%. You'll be able to take the intensity up higher. And so that's how you would make adjustments for these types of error conditions. A slightly different error condition is if the device sees that the BioWrap is attached and allows you to start turning up the intensity, but the intensity sensation doesn't feel very strong, it's very mild, and you ramp up and actually get to 100% or even 90% to 100% on your BioWave device, then that means that the impedance is still pretty high. And so we want to make the sensation feel stronger at a lower intensity number. So in order to do that, you need to pause the treatment, take the BioWrap off, take a clean towel, just rub off any excess conductive cream. Don't rub so thoroughly, just any excess. If there's any excess on the silver fabric electrodes, rub that excess off there. Reapply the BioWrap as in the directions for use, and then start the treatment, and you should be able to get north of 10, 11, 12% on your BioWave home device. So the key takeaway here is the tighter the compression and or the more conductive cream you use, the stronger the treatment sensation. The looser the compression and or the less conductive cream that you use, the lower or less treatment sensation that you'll feel. So that's kind of how you manage, how the sensation feels. If you're either way at the very low end of the intensity scale or way at the very high end of the intensity scale, you can do tighter compression, more conductive cream to get a stronger sensation, looser compression and or less conductive cream to get a lower or less of a treatment sensation. Let's talk about the protocol. So the protocol for using this is it's the same as if you were using our non-invasive electrodes. It's a 30-minute duration treatment, and we typically recommend 2 to 3 treatments per day. And you're going to get more of a cumulative benefit if you separate those 30-minute treatments by approximately 30 minutes. So you do a 30-minute treatment, then you wait 30 minutes, then you can do another 30-minute treatment. You treat on an as-needed basis. There's no limit to the number of treatments you can do in a day. And both doctors and patients report that they see cumulative benefits with multiple treatments over time. Contraindications are the same as with our other electrodes. Do not use this device or our BioWave devices if you have an implanted cardiac pacemaker. Do not use our devices if you have epilepsy or are prone to seizure. And do not place silver fabric electrodes in the BioWrap over open wounds, broken skin, rashy skin, or sensitive skin like sunburned skin. So the silver fabric electrodes must be placed over intact skin. That's very important because you don't want to further aggravate a skin condition. But BioWraps may be used directly over or in the proximity of any implanted orthopedic hardware, any metal hardware, including total joint replacements, anchors, plates, rods, screws, pins, clips, discs that have been replaced. It's totally fine to use that over any of these types of implanted hardware. In terms of cleaning, the silver fabric electrodes can be cleaned using any type of alcohol-based hand sanitizing wipe. So if you just want to clean the silver fabric electrodes, Purell brand, for example, makes a good alcohol hand sanitizing wipe. You can use that. It has no effect on the conductiveness of the silver fabric technology. Do not use other wipes that have other types of disinfecting chemicals in them, because those other types of chemicals can affect negatively the conductivity of the silver fabric material. If you want to wash the entire BioWrap, the very first thing you need to do is remove the 4-inch snap connectors on the back of the BioWrap. There's 2 of them, one here and one here. Unsnap it here, slide it through the little tunnel that manages the wire, and then do that on both sides, and now you can wash it. You can hand wash the BioWraps. You please do not put them in a washing machine, do not put them in a dryer, and do not dry clean them, because washing machine, dryer, and dry cleaning will kill the conductivity of the silver fabric. So we want to maintain that's in good condition. So the best way to hand wash these is just put them in a sink with some warm water, use some mild soap, and just use your hands, rub and clean the silver fabric, the neoprene, rinse it off with water, and then take a towel, pat it dry, and then leave it to air dry on top of a towel. And that is the best and really only way to clean it, unless you just want to use the wipes, alcohol wipes on the silver fabric. So that's my presentation on BioWave's silver Back BioWraps. Thank you very much for attending our webinar. Please submit your questions under the Q&A tab at the bottom middle of your window. And if you have any questions at all, If you don't think of any to ask right now, but they come up later, please contact us. You can reach us at 1-877-BioWave. That's 1-877-246-9283. Or you can also email us at info@biowave.com. Thank you so much for your time, and I look forward to answering your questions. Oh, and please don't forget to tune in next month for our monthly webinar. We've got lots of really interesting topics coming up over the course of 2023. Thank you again. Hi, everyone. If you have any questions, just please submit them in the Q&A box at the bottom of the screen. And I'd be happy to answer those questions. Looks like we've got a couple questions coming in. Okay. First question I have is, can you use the Back BioWrap while driving or in a car? Generally, we don't recommend that patients do BioWave treatments while they're driving, but the Back BioWrap is probably one of the exceptions because it may allow a patient to be able to comfortably sit in a car when they may not be able to sit due to pain at all. So as long as it's at a reasonable level and not too strong, and it's not interfering with the patient's ability to control the gas and the brake and control the steering wheel and whatnot, then it should be fine. Certainly as a passenger, you can absolutely use the Back BioWrap in the car. You can also wear it as a support garment without doing the stimulation, so that also may be helpful during a very long car ride as well. So another treatment is there a particular position you should be in while doing a treatment with the Back BioWrap? Should you be standing? Can you be standing and walking around? Should you be sitting? It really doesn't matter with the Back BioWrap because you've got compression and it's pushing the electrodes against the lumbar region of the back. So if you are sitting and you're leaning back against a chair or couch or whatever, that's totally fine because you're pressing your back against the Back BioWrap, against whatever chair or couch you're sitting in, totally fine. But also you can get up and walk around to do things around the house. You're typically going to be attached to a BioWave home unit, so you need to carry that with you. So you're a little limited in what you can do, but you certainly can walk around. You can go to the bathroom. You can do things in the kitchen and whatnot. So yes, it's definitely allows you to be mobile around the house. Let's see. Here we have another question. Is the Back BioWrap something you'd purchase or lease? You mentioned it's prescribed by a physician and purchased as an accessory when you get a BioWave home device. So we don't lease the BioWrap. It is an item that is purchased. Typically, you would be prescribed with your BioWave home unit a silver Back BioWrap. It's possible if you already have a BioWave home unit, or if the patient already has a BioWave home unit and they've got conventional surface non-invasive electrodes, hydrogel electrodes that have been prescribed, and the patient wants to get a Back BioWrap, then the doctor can prescribe that Back BioWrap to you as well. So it is a purchased device. Let's see, I have another question here. The question is, how does the Pro and Home work with the BioWrap versus not being able to use the Go version? So the reason is we need to, and I mentioned in the description, the reason we are able to get the signals from the device delivered through these much larger area electrodes is we have to put conductive cream on the skin and rub it into the region of the skin where the silver fabric electrodes touch. And the cream reduces the impedance of the skin to a very low level. And the BioWave Home and BioWave Pro devices can operate at a very low level skin impedance or impedance of the electrode skin interface. So unfortunately, the BioWave Go device was not designed to work at such a low impedance level. So that is the reason BioWave Go cannot work with the silver fabric silver fabric BioWraps in general. Another question here. It says, you mentioned solutions for low or high impedance, add more cream or wipe away cream. Does the error message on the device let you know if the impedance is too high or too low, or does it just tell you that there's a connection problem? So the answer is the device cannot tell you whether it's too high impedance, meaning the skin's very dry or oily, you didn't clean it, there's no conductive cream on the skin, or if the impedance is too low, you've put too much conductive cream on the skin. But with the device, so the error message that the device provides is just that there's a connection error, and it tells you where that connection error is. And there's 3 points of connection where there could be an error. It's where the cable plugs into the device. It's where the other 2 ends of the lead wire cable plug into the 4-inch snap wires to the blue connectors at the bottom. And then the third error connection is the electrodes being in contact with the skin. So for a high impedance or low impedance error condition, you would just see the icon of the 2 electrodes with an arrow pointing to an outline of the body, meaning the device doesn't see the electrodes on the body. And in this case, it's referring to the permanent silver fabric electrodes within the BioWrap. Another question. It says, the question is, rather than using hand sanitizer to clean silver electrodes, can 70% isopropyl alcohol be used to clean? And the answer is yes. So we're not specifically recommending hand sanitizer. We're really recommending an alcohol wipe. And so you don't have to use a Purell brand wipe, but that particular wipe is basically a 70% plus isopropyl alcohol wipe. And we have thoroughly tested the BioWraps with that type of wipe, and alcohol does not affect the performance and the conductivity of those silver fabric electrodes. So if you just have 70% isopropyl alcohol, please do not pour it directly on the electrodes, rather pour it on a cloth of some type, and then use that cloth to scrub down the silver fabric surface, and that will be fine. So the answer is yes, you can use 70% isopropyl alcohol to clean the silver fabric portion of the BioWraps. That, I believe, is the last question. Does anybody else have any other questions that I can answer? Okay, if you think of one, and you can send questions to support@biowave.com or info@biowave.com, or call our toll-free number 1-877-BioWave. I want to thank you very much for attending, and please tune into our webinar next month. It will be on percutaneous electrical nerve stimulation. And we look forward to seeing you again. Thank you.